Welcome back to another episode of Top Line Health and Wellness Podcast, the podcast where we dive into the evolving world of pharmacy to provide clear, reliable information that you can trust. I'm Dr. Gina Nana, your host and clinical pharmacist at Top Line Pharmacy. Today, we're addressing a topic that affects millions of people every day: pain management. Pain can be acute or chronic, mild or severe, and it can significantly impact your quality of life. Effective pain management is crucial, and there are various medication options available to help manage pain effectively and safely. Let's explore these options in detail. First, let's discuss over-the-counter options. For many, non-prescription pain relievers are the first line of defense. Tylenol is a popular choice. It's effective for mild to moderate pain and is often recommended for headaches, muscle aches, and arthritis. Tylenol works by blocking the production of prostaglandins, which are chemicals in the body that cause pain and inflammation. One of the advantages of Tylenol is that it is generally safe for most people when used as directed, though it's important to avoid exceeding the recommended dosage to prevent liver damage. Another category of OTC pain relievers is nonsteroidal anti-inflammatory drugs, or NSAIDs. This group includes medications like ibuprofen and naproxen. These work by reducing inflammation, which makes them particularly useful for conditions like menstrual cramps, dental pain, and minor injuries. They inhibit the enzymes that produce prostaglandins, thereby reducing pain and inflammation. However, it's important to use NSAIDs with caution, as long-term use can lead to gastrointestinal issues such as ulcers and bleeding, kidney damage, and an increased risk of cardiovascular events like heart attacks and stroke. For those with pre-existing health conditions, it's essential to consult with a healthcare provider before using NSAIDs regularly. When OTC options aren't sufficient, your healthcare provider may prescribe stronger medications. One common prescription option is opioids. These medications, such as oxycodone, hydrocodone, and morphine, are highly effective for severe pain, particularly pain resulting from surgery, injury, or cancer. Opioids work by binding to receptors in the brain and spinal cord to block pain signals. While they can provide significant relief, they also come with considerable risks, including dependence, addiction, and overdose. The opioid crisis has highlighted the dangers of these medications, making it crucial to use them under strict medical supervision. Patients should follow their provider's instructions precisely, store the medication securely, and dispose of any unused pills properly to prevent misuse. For certain types of pain, especially neuropathic pain, other classes of medications might be more effective. Antidepressants, such as amitriptyline and anticonvulsants, are often prescribed for conditions like fibromyalgia, diabetic neuropathy, and postherpetic neuralgia. These medications work by altering the way the brain processes pain signals. Antidepressants, for instance, can increase the levels of neurotransmitters that reduce pain signals, while anticonvulsants can stabilize nerve activity. It's important to note that these medications often take several weeks to show their full effect and may come with side effects such as dizziness, drowsiness, and weight gain. In addition to these systemic medications, there are also topical treatments available. Creams and patches containing ingredients like lidocaine or NSAIDs can provide localized pain relief with fewer systemic side effects. These treatments are especially useful for conditions like arthritis, muscle strains, and minor injuries. For example, lidocaine patches can numb a specific area, providing temporary relief from nerve pain, while capsaicin creams can desensitize pain receptors in the skin. Moreover, for individuals suffering from chronic pain, other treatment modalities should be considered as part of a comprehensive pain management plan. Physical therapy can improve mobility and reduce pain through targeted exercises and manual therapies. Cognitive behavioral therapy can help manage the psychological aspects of chronic pain, teaching coping strategies to deal with pain more effectively. Acupuncture, an ancient Chinese practice, has also been shown to provide relief for certain types of pain by stimulating specific points on the body. At Top Line Pharmacy, we're here to help you navigate your pain management journey. Whether you're looking for advice on OTC options, need help managing your prescriptions, or exploring alternative therapies, our team is ready to support you. We understand that pain is a complex and personal experience, and there's no one-size-fits-all solution. It's important to work closely with your healthcare provider to develop a comprehensive plan that meets your specific needs. As we conclude this episode, I want to emphasize the importance of communication. Always inform your healthcare provider about all the medications you are taking, including OTC drugs, supplements, and herbal remedies, to avoid potential interactions. If you experience any side effects, or if your pain persists despite treatment, don't hesitate to reach out to your provider for advice. Thank you for tuning in to this episode of Top Line Health and Wellness Podcast. I'm Gina, and as always, we're committed to helping you live a healthier, happier life. Stay well, and we'll see you next time.